In this video, I will say a few words about bias. Bias is a crucial concept in all kinds of science, especially perhaps in epidemiology, but also in clinical trials. Bias is a word for systematic errors, not random errors, but systematic errors. And we suffer from bias when we analyze data, interpret data, or publish data in a systematically incorrect way. I will illustrate this through three types of bias: selection bias, measurement bias, and confounding. Here is an example of selection bias. Sorry about all the text. For instance, patients in my study differ from the average patient. That could be due to different sex, different age, different disease severity, and different amount of comorbidity when we compare the study patients and the average patient that I want to say something about. For instance, let's assume I want to study the mortality in patients with the flu. Identify patients with a record flu in hospitals and look at their mortality. What is the problem? Well, the problem here is that mostly older patients and patients with severe flu or patients with other diseases as well are hospitalized with flu. Mortality in my study will be overestimated because I do not study the average patient with flu. Instead, I've identified patients who are older, who have a more severe flu, and who have other diseases, and that will make me overestimate the mortality in flu. Another example is here. Let's assume I'm a surgeon and I'm carrying out laparoscopic surgery. I now want to examine if laparoscopic surgery causes pain or less pain. So after laparoscopic surgery, the physician asks the patient about pain and return to work. I have a couple of problems. Well, because before the surgery, the surgeon had only picked the healthy patients for laparoscopic surgery, only the healthy ones. He or she also expected the surgery to cause less pain, and this influenced the way he asked for pain, and patients themselves were told before the surgery that they could probably go back to work earlier than if they'd had open surgery, and that will of course influence the answers they give. So here, an assumption that laparoscopic surgery is less severe will influence the answers of patients. Measurement bias. This is that we systematically measure something in a different way in a certain kinds of patient. For instance, a patient with oral contraceptives arrives to the emergency department. We ask her about medication and she tells us she has oral contraceptives. That makes her more likely to be examined for venous thrombosis, since venous thromboembolism has been linked to oral contraceptives, and then we're more likely to find venous thromboembolism in patients with oral contraceptives. So just by telling the physician, I have oral contraceptive, will direct the physician towards looking for venous thromboembolism, a kind of measurement bias. Patients with type 1 diabetes are screened for celiac disease in Sweden, and this will of course increase the prevalence of celiac disease. So if we screen everyone with type 1 diabetes, we will find much more celiac disease than in the average patient, the other average person who is not screened for celiac disease. Finally, at the vårdcentral, the general practitioner, he's having patients with a new type of antihypertensive drug. The general practitioner measures all the blood pressures of patients with a new drug, while patients with older drugs measure their blood pressure with a nurse. Of course, that can introduce bias, since everyone with a new drug has his blood pressure measured by a physician. Everyone with an old drug has his blood pressure measured by a nurse. And how does this translate? This translates into this, something we call the white coat hypertension, where in the same individual, having the blood pressure measured by a physician will result in a higher blood pressure than if you're having the blood pressure measured by a nurse. We call this white coat hypertension, a form of measurement bias. You may have a different blood pressure measured, a different atmosphere in the room, and you're assumably more calm when you meet a nurse than a physician. Last concept is confounding. Confounding means that both the exposure and the outcome are influenced by a certain factor, an underlying factor. In this example, I want to study the association between antioxidant intake and the risk of cardiovascular disease prevention, well, the risk of cardiovascular disease. However, both these, antioxidant intake and the risk of cardiovascular disease, are linked to certain underlying factors. For instance, mostly old people eat antioxidants versus those without antioxidants, which are on average younger people. Antioxidant intake and cardiovascular disease are also linked to aspirin use, physical activity. People who are very health aware tend to exercise more and take more antioxidants. So perhaps it is the increased amount of physical activity that protects against cardiovascular disease rather than the intake of antioxidants. Same thing here. Non-smokers, people aware of healthy behavior, will smoke less and will take more antioxidants. Perhaps it's the lack of smoking that protects against cardiovascular disease rather than the antioxidant intake. The same with family history and diet. All these factors may be underlying and explain both the antioxidant intake and the cardiovascular disease. They are confounders. Thank you.